and gentlemen, I am Dalia Gamil. Welcome back to Healthy and Happy Living with Tiryak. Hopefully you can hear my smile. Today we are bringing you conversations that inspire, inform, and innovate. We're thrilled to be joined by Dr. Elhami Nicolas, Doctor of Dentistry, Implantology, and founder of Nicola ASP. With years of experience in cutting-edge dental care and a deep commitment to patient-centered practice, Dr. Nicolas has built a reputation not just for clinical excellence, but also for leadership in the evolving world of modern dentistry. In this episode, we will dive into his journey as entrepreneur, his approach to implantology, and the vision behind Dr. Nicolas ASP. This conversation is packed with valuable insights, so let's get into it. Hello, Dr. Nicolas.
Hi, Dr. Dalia. Pleasure to be with you.
Thank you. Dr. Nicolas, what inspired you to start a career in dentistry and how did it lead to your current leadership role?
When I was finishing, or about to finish my high school, I had cousins who were in the medical school. So I had the chance to go and visit them and spend a few lecture days, and I was attracted by the fact that it is in the spirit of helping people in a way. But for myself, I have found that medical school is a long journey, and I had a good inclination for engineering, for designs, and the dentistry seemed to be the right fit. Bearing on mind that I was always fond of playing and dismantling small things and mantling them again, so I had the dexterity in my hands already, which has served me well for my study in dentistry. They say that dentistry is the art that gathered medicine and engineering. So basically it was a perfect fit for me.
That's awesome.
Yeah.
We are looking forward to hearing from your good self about Dr. Nicolas' effect and how it shaped your philosophy in practicing dentistry.
I think there are two ways to look at dentistry. One that is a little bit more mechanical, and one that distinguishes every patient as being a pure individual case where you have to dive deep and find a real tailored solution for him. And although dentists are dealing with teeth, but they are involved in the appearance, they are involved in the smile, so this brings them to a little bit larger era of caring for patients. Not by doing aesthetic work for his face, but in understanding his needs. So not two persons have the same needs, but many people would share the same skills that they have in order to establish a personalized treatment plan for them. This is what we call the Nicolas. In fact, it goes behind the teeth. It goes into understanding the profession, understanding the needs, whether he meets people frequently, whether he needs to have an appearance only on occasions, and accordingly you can tailor the needs according to them. There are people who are scared of dentistry, so you have to be very gentle and sometimes to choose the shortest treatment plan to achieve the maximum result. So the Nicolas effect deals with the human being, not the teeth.
Okay, so the Nicolas effect is life changer.
Anyway, yes.
Perfect. How has this approach impacted your own life and well-being?
I think understanding people's needs is something that is desirable in life because it helps you as well to extend more help to people even outside of the clinic. It changed the personality to be more of a caring person rather than being self-centered.
Awesome. Dr. Nicolas, please share with us highlights of your journey of practicing dentistry in the Arabian Gulf.
It's an interesting journey for me. I came to Dubai in the year 91, and this was after the Gulf War. And it is at that time that Dubai was gaining speed to move from a small island in a way, if you want to say, to enter into the sphere of being international. And I have witnessed the fast and robust development that were led by the Dubai government and the UAE government, and It was a lifetime opportunity to be present at that place, at that specific time frame. It was clear that with that development, many things in town needed to be developed, as well as dentistry, okay? And having been trained on implants in the US, I had a first-hand knowledge of the cutting edge of dentistry at that time. And I found that this would be a fertile ground to implement what I know, what I have learned into my practice over here.
That sounds very inspiring, Dr. Nicolas. As someone who lived in Dubai and the UAE for around 21 years, continuously I can tell that Dubai is a big opportunity for everyone who is pursuing success. Yeah. And healthcare developed a lot in this duration entirely.
Sure. Yeah.
What are your first impressions of the healthcare landscape in the region?
That they needed to be upgraded. And they needed to move from the sphere of general dentist, the good old guy that does everything, in order to move into the world of dental specialties, mimicking what was happening in the US in a way. And of course, this carries lots of benefits for patients because they get really highly trained and educated people to handle specific problem. No one can be good in everything. With time, are gone forever, you know?
True. So what were some of the biggest challenges you faced when you started practicing here?
Really, on those early days, there was a trend by most of the patients to use clinics in dental clinics in Dubai only for emergency care. And they would defer their treatments to be done back home on their holidays. And this was the biggest challenge to change those mentality that they can get here what is equivalent and sometimes better of what they can get home. And this has been always our motto, that what we offer should be second to none. And we were, I'm not saying we're only, but I'm sure there are others who were facing the same problem, that were eventually very successful in moving the trend for people to sacrifice their holidays only for the family and traveling and enjoy, and trying to finish all the dental care during the month when they are working in Dubai. And this was a major shift in the way clinics had operated.
Perfect. And I think also this have inspired the government of Dubai for private-public partnerships to enhance medical tourism in Dubai and the UAE. And now we can see that Dubai is a real destination for medical tourism.
I have to be fair in saying that the health authorities in Dubai and Abu Dhabi have played a pivotal role into advancing the healthcare in the region, because they look to it far beyond the limitation of the private practice, which is more of a national drive rather than individual drive. But they did very well.
Good. So how has dentistry itself as a practice evolved in recent years, and what innovation excites you the most?
I think dentistry is advancing or evolving almost every day, because we have reached the stage where the sum of the human knowledge is focused to solve one problem at a time, which brings lots of solutions from many different industries that can be implemented into dentistry. I still recall one of the companies were offering, and I don't talk about commercial names, was offering an adhesive that we use to stick fillings in their place. And when I raised the question that the masticatory forces may be strong, are you sure about this? They told me that this glue is used to glue some parts of the aeroplane wings, all right? So it tells you that there is a crisscross of utilization of technology, and the research is blending into every small thing that we do, all right? So these are very, very good times regarding dentistry if they are used wisely.
It's a great response to research and development as well.
Of course.
So what role does technology play in modern dental practice?
I think most of what we have is directed into the area of more patient comfort during procedures, into better diagnosis, into better treatment planning, all right? And these are the three areas that will touch directly the patient. Lots of technology today is used to minimize the human error. And if there is anything that all of us have in common is that we do mistakes, all right? And despite having protocols and very good training, human nature is the human nature. So technology today is trying to minimize the human error to be almost, it will never be there, but to almost that. So it helps the individuals in order to be able to provide better treatment with less drawbacks. Okay?
Excellent. Top safety and better quality of life.
Of course.
What are your expectations, Dr. Nicolas, for dentistry advancements in the short and long term?
I think it will keep on improving in this direction. One of the areas is to facilitate techniques that are too complicated. But we have to take a little bit of caution here that some technology do really help me to simplify things that are very technical. But some other parts are aimed at letting people do things that are not very well trained for. And this is what I feel people have to be very cautious, because we should not be driven simply by the technology, but we should have a very deep understanding what to do and to use the technology to facilitate it. So I am personally against a little bit simplifying things to the extent to doing things that people do not have enough knowledge about them. Right? It is not enough that you can do it. You should be the monitor of what the technology is helping you to do. Because if there is any problem, you are supposed to solve it. You are not going to find someone else to solve it who knows. So this is a little bit tricky part that is happening for the last few years.
Yeah, basically the robotic treatments, so doctors have to be very well trained for them.
Yes, yes. And when we reach the full robotic, there are enough safety measures that have been embedded within the product. But if we're doing a semi-robotic, the semi on my part, I need to have a very good knowledge about it, otherwise I'm driven. And this is the problem.
Yeah, actually that's something that been revolving in my mind since I heard about robotic surgeries, that humans should be more qualified to be able to monitor and drive the robot, not the other way around.
Yes, in a way, yes.
So, Dr. Nicolas, how does oral health contribute to overall health and well-being?
Well, oral health has different aspects. Oral health maintains healthy gums and teeth, which on one hand offers a better appearance and smile. This has an impact on the way people have confidence in meeting people, smiling, of course, the way they talk, and having good teeth allows us to masticate food properly, so it contributes to better digestion. So the body is interconnected in one another. We cannot claim that one special part could be the one who offers the health. No, it is a combination of everyone. And when you look to the human being as a global, you understand that every part has its own function to maintain that good living thing.
Yeah, true, very true. So what has been the most rewarding aspect of practicing dentistry in general and in the Arabian Gulf region specifically?
I guess one of the most important things is that, first of all, the authorities are supporting in a way private practices, and you see practice blossoming like anything. Number two, we are in a place where it's an open market, so any best equipment you want to buy you can get, any best material you want to buy you can get. There are no restriction, importation and stuff like this. Number three, the diversity of the population makes you at the constant challenge for yourself to be able to offer the best possible treatments with the best possible outcomes. Because you cannot generalize a specific outcome. Let's say a procedure is not gauged against a UAE standard, Egyptian standard, English standard, American. It is on international standards. So this has been always a drive to be in a self-competition mode in order to improve at all times.
Is it easy to be in self-competition mode at all times?
I think there is a false idea that dentists are competing with each other. I don't see this as being true. This is a totally wrong thing. Because at the end of the day, patients choose what they feel is best for them. So the best competition for me is to improve myself.
Yeah.
I cannot change others, God bless them. Number two, Dubai will never have one dentist or one surgeon or one lawyer or one engineer.
Yeah.
With the growth of Dubai, there is room for everyone. What is still needed is the top quality and excellence in what you do. And this will always be a rare coin that will have a place into the landscape of Dubai.
Yeah, it will be always the optimal goal.
Yes.
Dr. Nicolas, how do you see the role of preventive dentistry evolving?
I think preventive dentistry has a problem in private practice because many clinicians would rather focus on therapeutic procedures because they are better paid, time versus money, and they solve problems on spot. While preventive dentistry is the base where a practice has to be built on, because it is the base that any therapeutic need that I have and fix should be embedded within the preventive program I have, so people can enjoy what I'm offering them for years to come. And to the mentality of the community, no one wants to go to the dentist every 6 months with a hole in his teeth. I would like to go have them clean, polish, some provides, whatever it is. So we are very focused to be sure that preventive and education are basically offered at equal potency as treatments. And maybe this is one of the reasons of the success of Dr. Nicolas. All right.
So, educating patients.
Of course. If they don't know how to maintain their teeth, you keep on drilling.
That's true.
All right. But you want to reach the stage where they feel the value of what you're offering, that they're enjoying life with no dental problem, simply doing systemic prophylactic work. And that's it.
Agree. What changes would you like to see in healthcare systems to further support oral health?
I think healthcare systems have developed a lot over the last several years, and dentistry is having its place within the landscape of healthcare. Is there things that can be done more? I'm sure there are things that can be done more, but I don't see any hindering thing to offer very good dentistry in town. It's just the will to do it, okay? Some practices may not be very happy with the fees charged by insurance, which usually is not known by patients anyway. But nevertheless, I think every practice has its own way to absorb and to maintain efficiency in order to be able to provide very good service at a reasonable rate. You should not be penalized because you're going to fill it with, all right? You should not need to pay car value in order to have a couple of implants. I'm against this 100%, all right? This is not what is the spirit of dentistry. Dentistry is helping people at the end of the day. I'm paid for it, for sure, but people cannot be penalized because they have the problem.
Agree. How does the multicultural nature of the region influence patient care?
I have touched a little bit on this if you have several nationalities, and we have around 200 nationalities in Dubai, what you offer should not be specific to a certain nationality or a certain country. Should be offered what we call the state of the art. And the state of the art is something that you get in your education that is enhanced by continuous training all the time. And that's why myself and my colleagues are upgraded on the latest of what is happening worldwide. And this is how we can, within a multi-cultural place, be sure that you are at the top of your game.
Awesome. Dr. Nicolas, what are some common misconceptions about oral health that you often encounter?
There is always a little bit of misconception that in the absence of pain, teeth are okay.
Agree.
But in reality, there are several dental problems that are painless. And when they start being noisy, it is usually a little bit too late. You need lots of work to be done. One among those exceptions is the gum care.
Yeah.
A little bit of sensitivity sometimes with hot and cold should not get through easy, all right? A little bit of occasional bleeding of the gums is not easy. These are little silent indications of a problem brewing under. And the value of the routine 6 months checkup is to discover those silent things occurring, and you can address them and tackle them. Number two that I see is that sometimes people think that simply by going to the Hajj to clean their teeth, if there was anything she would have told me. And this is totally wrong, right? Because again, there is a difference between a dentist and a hygienist. Everyone has his role within the dental sphere. Number two, there is expertise that is not there. Number three, there are diagnostics that are not usually done, X-rays, panorama, stuff like this. So this is a little bit amputated understanding of the role of the 6 monthly visit, all right?
Yeah, and this takes us back to the role of preventive oral health care.
Yes. But some people think if there was a problem, they should have told me, so they don't need to do the checkup. And they think this is a very wise way to save the consultation. Personally, I don't see it this way.
It's evolving.
Yeah.
How can healthcare professionals work together to improve public health awareness about dentistry?
I think it is, I am talking here about the private practice, private clinics. If everyone would have devote a little bit more time to education and prevention, eventually this would teach to be a group or a community understanding. We have conducted for years preventive educational programs in schools, all right? And we have found that this is very important and crucial at a certain age, where you are forming the habit of looking. And again, it's a little bit of a reminder for parents home that have to be focusing more on this, okay? But I think compared with other communities, I think we're very good in this respect.
I think this is giving a long-term effect on the patient, right?
Yeah, understanding the importance of milk teeth is essential, because milk teeth occupy or reserve the place for the permanent teeth to erupt. So if we're not keen to keep them healthy and we lose them early, we would stand the chance that the permanent teeth will be misaligned. And definitely children have to get braces and stuff like this. It is not the only case for braces, but it is one of the situations where braces will have to rectify. But I guess raising children is a journey, all right? And
True.
definitely children will just do what they have been taught and what they have seen. And if I'm not keen on sharing this by helping, supervising, then by letting them watch what I do, they cannot develop a habit. Habits don't come by talking, they come by listening.
Exactly.
Yeah.
And this is really a bright idea because it's gonna be educating children from childhood to take care of their oral health.
Yes.
Dr. Nicolas, what's your vision for the future of dentistry practice in the era of artificial intelligence?
I think that we will see more and more applications that will help reduce error, and this is very important. Number two, artificial intelligence can collect many data that not necessarily a human brain can synchronize as fast as, but it will always be up to the operator, the clinician, in order to read through the data and be guided, not simply by tuk and that's it. No, it will not reach the stage where you will get rid of the dentist's knowledge, all right? But it will help a lot in patient care, that's for sure.
Perfect. What lessons can healthcare professionals from other fields learn from advancements in dentistry?
I think we don't have that much for people to learn from us because everyone now is learning from the situation where all knowledge can be reached and applied in a second. Even now, pharmaceutical companies do not need to do trials on patients because sometimes computers can mimic exactly what will happen. So we're in an era where knowledge is available for everyone, all right? To be up to that person whether he would like to grow something of benefit for him or not. But we use materials used everywhere. We use techniques, implants. Some of what we do, orthopedic surgeons have been using for a while. So it is drawn from there for us. So every branch of care, in a way, can derive all what they need from others because it's an open source to them. Nothing is hidden.
That's really awesome. Dr. Nicolas, if you could give one piece of advice to young oral healthcare professionals, what would it be?
I think we are in an era where money plays a central role in people's minds. And for the young dentist, I think the best piece of advice is what I had when I was a young dentist by others, is that my concern should be solely in increasing my knowledge and expertise to do things second to none. If you reach that stage, that you have developed your skills, backed by your knowledge to do very good work, money will come on its own. You don't need an effort to do the money. Patients are ready to pay for proper dental care. I'm not saying proper dental work, saying care, it's global, understand. Unfortunately, these are times where people are a little bit more focusing on money. And this is not very good, especially for young, because you will miss the time where you can enhance your skills to be really very good.
I agree 100%, and even that's always my advice. Don't chase money, chase success, and money will be there automatically. That brings us to the end of today's episode. A big thank you to Dr. Elhami Nicolas for sharing his expertise, experience, and vision with us. From clinical insights to the entrepreneurial journey behind Dr. Nicolas and ASP, it's clear that Dr. Nicolas is not only advancing dental care, but also inspiring the next generation of professionals. If you found this conversation valuable, don't forget to subscribe, leave a review, and share this episode with someone who might benefit from it. And as always, thank you for listening to Healthy and Happy Living with Tiryaq, where great minds in healthcare and innovation meet. Until next time, stay curious, stay inspired, and take joy wherever you go.